Healing disorganized attachment is a complex and nuanced process, and it involves a combination of therapy, self awareness, and supportive life relationships. Disorganized attachment typically stems from inconsistent or traumatic caregiving experiences that occur in early childhood. Now, these experiences lead to difficulties in forming secure and organized ways of relating to other people. Steps to healing disorganized attachment. One, first step, get yourself into the highest quality therapy that you can. Seek professional help from therapists who specialize in attachment issues and trauma and who practice more relational therapies. These are things like attachment based psychotherapy, emotionally focused psychotherapy, sometimes called EFT, dialectical behavioral therapy, DBT, and attachment focused EMDR. They can all be particularly beneficial. I've seen neurofeedback, when administered by a trauma specialist, be hugely helpful to my clients. When you interview a trauma specialist and inquire about the depth and the breadth of their advanced training, a therapist who treats trauma can help you to explore the origins of your attachment patterns, to process unresolved emotions, and to develop healthier ways of relating now. A seasoned, qualified trauma therapist will be adept also at treating dissociation. And that's something that's essential for getting better if you're struggling with disorganized attachment. Number two, develop self awareness. Understanding your attachment pattern and recognizing how it impacts your relationships is a crucial step. Self awareness allows you to identify your triggers, identify your emotional responses, and identify your patterns of behavior. All of these stem from your disorganized attachment. So, journaling, introspection, and mindfulness based practices can all contribute to your greater self awareness. Number three, mindfulness and self regulation skills. Learning how to regulate your emotions and manage distress is vital in healing disorganized attachment. It's what I call the necessary first step. So, again, practices like meditation, deep breathing, grounding techniques, and other self regulating practices will help you to stay present in difficult moments and to prevent reactive responses which are triggered by your past attachment wounds. Number four, resolve your trauma. Your disorganized attachment style is a result of early, unresolved relational trauma. Addressing and processing that trauma is essential for recovery. This should involve working with a therapist who is very experienced in trauma therapy. And as I mentioned, these would be modalities like EMDR or sensory motor psychotherapy or trauma informed internal family systems. A good therapist will also be able to help you process early nonverbal trauma. Number five, create healthy relationships. Engage in relationships that are safe, relationships that are supportive and understanding. Healthy relationships, romantic relationships, and support networks can all provide the positive experience that you need to rewire your attachment system. And this is something that occurs over time. Remember, the biggest influence on you is the people that you surround yourself with. So be careful who you surround yourself with. Notice, are these people that normalize unhealthy behavior or not? If everyone around you, for example, gets drunk after work and everyone around you hates physical fitness, you probably will too. However, if you're around people with healthy habits, their good habits will also rub off on you. Conversely, if you have people around you that are reactive, unstable, and ultimately emotionally or physically unsafe, you're not going to be able to heal your disorganized attachment style. And you won't be able to develop what we call earned secure attachment. That is a developmental leap that takes place psychologically and neurophysiologically. Number 6, cultivate your secure attachment behaviors. Practice and gradually integrate secure attachment behaviors into your current day relationships. We change our lives through skillful, intentional action. And when I'm talking about this, I'm including communication, expressing your needs, being responsive to other people's needs, and setting your boundaries skillfully. Honor your agreements with other people. Make them explicit, clarify, and refine them when you need to. 7, inner child work. Engage in inner child work to connect with and heal the wounded parts of yourself. Now, this might involve visualizing and or interacting with your inner child, offering comfort, understanding, and validation. You're going to need a skilled therapist to do this effectively. Now, self-help is fantastic. As I've said in other videos, I'm a big fan. But if you have disorganized attachment, you're going to need to do a lot of your healing work within the context of a deep therapeutic relationship. Then you will transform. 8, education is key. Decide in advance that you are going to be a great patient. That means prioritizing your recovery. I'm going to be real with you for a second. Anybody who works in healthcare will tell you that in reality, there's a range of patients. There are great patients, there are terrible patients, and there's everything in between. A great patient engages actively with their therapist. They ask great questions, they make requests, and they offer feedback. They understand that it's teamwork. A great patient does their own research, and they use that to fuel their recovery. Educate yourself about attachment theory. Educate yourself about the symptoms that you're struggling with. Educate yourself about trauma and how people recover and what's needed. Discuss with your therapist how it applies to your experience. This knowledge is going to empower you to recognize unhealthy patterns and actively work to change them. 9, grow patience and self-compassion. Healing your disorganized attachment takes time. So be patient with yourself, practice self-compassion. Don't expect the quick fix. That's going to be a setup for failure. Understand that progress is not always linear. Setbacks are going to occur. Treat yourself with kindness as you navigate this journey of trauma recovery. 10, be consistent. Consistently applying what you learn in therapy, practicing new attachment behaviors in your relationships. That's something that's key to transforming your attachment style. Practice your emotional regulation skills and your relationship skills. Remember, healing from disorganized attachment is a gradual and ongoing process. With dedication and the right kind of support, you can develop more secure, more flexible, and healthier ways of relating to others. In the psychology world, as I've mentioned, we refer to this as earned security. And that's a thing. I've seen people do this literally hundreds of times. It's just that it takes the right approach, it takes dedication, and it does take time. Remember, I know that I've said this before, but it's so important to involve a qualified therapist, a qualified mental health professional who can provide you with personalized guidance and support throughout your journey. Remember, you're making one of the most important investments a person can make when you embark on your therapeutic journey. Healing disorganized attachment. You can learn more. Please have a look around my website. The link to my site is in the description nearby. And if you go there, you're going to find a few hundred articles on trauma related topics such as trauma treatment modalities, PTSD, complex PTSD, and a bunch about developmental trauma. It's my hope that you find something of worth, something of value to you in both my writing and my videos. Thanks so much for watching. If you found this useful, please like, subscribe, and share this video.